So 6 Month Smiles is a short-term orthodontic system that we use here at Morrison Dental Group to help patients that have concerns with regards to, positioning of their teeth, their bite, and that helps improve their smile overall. The optimum candidate for the 6 Month Smiles is a patient that has had previous history of orthodontic treatment that is mostly focused or concerned on maybe like a couple of areas, especially on like the anterior aspect of their teeth or their front teeth is really their main concern. Most of these patients tend to be patients that have already, like I said, had the orthodontic treatment, and it's mostly just maybe tweaking a little bit on the positioning of their front teeth. The average, yes, it is 6 months, but there are some cases where it can be a little bit more, around 9 months, or some cases that we've done have been done in 4 months. So it really depends on a patient by patient basis. Right. The results after the 6 Month Smiles treatment can be literally night and day. We've had some patients that have not had orthodontic treatment before, and then all of a sudden they go through the treatment, and because they've seen themselves in the mirror, day in, day out, for literally decades, all of a sudden with maybe like a 6 Month Smile treatment that will last around 6 months, all of a sudden it changes their life, changes their outlook, and some patients are very impressed on how quickly and how efficiently the system works.
Like 6 Month Smiles, ClearCorrect is another option oftentimes for adults who want to straighten their teeth. The big difference is rather than having clear brackets, with ClearCorrect patients actually aren't in braces at all. So instead, there's a custom set of aligners that guide patients' teeth into the proper position over time. So this is an excellent option for patients who don't want to have braces, period. So the average length of treatment with ClearCorrect is usually between 4 and 12 months. That's assuming that the patient is compliant in wearing their aligners. So the aligners should be worn about 22 hours a day. They're only removed when you eat or when you're brushing and flossing your teeth. So if a patient is wearing their aligners all other times during the day, then treatment should be about 4 to 12 months on average. ClearCorrect, 6 Month Smiles, even comprehensive orthodontic treatment are all options. It depends on a variety of factors, including length of treatment, cost, and patient preference. So 6 Month Smiles is a great option for patients who are looking for speed of treatment, whereas ClearCorrect is a wonderful option for patients who don't like the idea of having braces. So I encourage any patient to come in for a consultation, and their dentist can help them determine, which option's right for them.
We're an 11-week dental assisting program. We offer classes on weeknights, on Monday and Wednesdays to accommodate for student schedules, and we focus a lot on internship and hands-on learning as well throughout our program. So we have a very small class size. We normally keep our classes around 10 or 12 students at a time so that we can focus a lot on one-on-one learning. The class is comprised of the class time as well as internship time, and we also do labs as well so that students can attend the class, and then the second portion of their class they're able to actually practice on one another the different procedures that they're learning. We also have our internship time, so they basically get a feel for what it would be like to work as a full-time dental assistant throughout the week. We start everyone off on the administrative side, so they're able to sort of see how we interact with patients, and then we move on to the hygiene side so that they're able to observe hygienists and sort of act as a hygiene assistant, and then the main goal, of course, is to get them in the dental assisting chair to be able to practice firsthand what it would be like to work as a dental assistant. Our class is very fast-paced, so when students come in, they can expect to learn a lot of information from the get-go. We start on night 1 with their first lesson, and there's homework and quizzes in every single class that they come in. They can expect to gain real-world hands-on experience. That's our goal, is to be able to really show them what it would be like to step into the shoes of an active assistant, as opposed to just coming to class and listening to a lecture and then going home and doing homework. We like to actually get them actively involved. All of our instructors are current assistants, hygienists, and administrative staff that work in the field. So everything that they work with every day is basically what they're teaching these students. So, they're teaching the students about the latest technology and keeping everything really up to date with what's going on in the dental field. After graduation, students are able to immediately get a job as a dental assistant. They can also go on to hygiene school. Some students even go on to dental school afterwards. We're a really great foundation basically for students who want to enter any area of the dental field. We have some students that go on to be administrative staff in a dental office or a hygiene assistant, some that go on to work in dental labs, but there are quite a few different options for students when they finish the program. Most other programs that people offer in this area are roughly 1.5 to 2 years to be able to become a dental assistant afterwards, as opposed to, our program, which is only 11 weeks long and it's a couple $1,000s, versus some other programs that may be $20,000, $30,000 to go through, since it's such a longer program. So it is a very fast-paced program, but we try and keep the classes small so that we can really focus on each student and make sure that everyone's getting the benefit of everything that we're teaching. The majority of the students who come through our program are generally students who have recently completed high school, maybe some that finished school and got a job somewhere for a little bit, but they're ready to start their career. We also have a lot of students who come in who maybe have spent a few years working in a career field that just isn't as fulfilling as they'd like it to be. So the appeal to be a dental assistant is fairly high because of the fact that you work whatever hours the dentist wants you to work. A lot of dental offices are closed on Fridays, majority of them are closed on the weekends, so it's a lot of people that come through that really want a really good, a really nice work-life balance.
Sleep apnea is obstructive breathing at night. Basically what happens is when somebody's sleeping, their airway gets obstructed and they can no longer breathe. So they're no longer getting air to the brain, and that can cause a lot of issues in the future. Many individuals are at risk. Now, what you want to think about is a few things. How old are you? Are you over 60? If you are, put one finger up on your hand. Are you a male? If you are, put another finger up on your hand. Do you have a large neck? Are you overweight? Are you being treated, or have you ever been told you have high blood pressure? Keep putting fingers up if you're answering yes. Do you snore at night, and is that snoring loud? That's another finger. Has anyone ever observed you stop breathing at night? If you have multiple fingers up right now, you're at high risk for sleep apnea, and you should definitely ask either your primary care physician or your general dentist. A lot of people who have sleep apnea try CPAPs. The failure rate for CPAPs is extremely high. Now, don't get me wrong, CPAPs are great, they're the gold standard, but most people cannot wear them. They either don't like the sound, they're unable to wear the mask leaks, or they're just not open to trying it. And that's okay. We fill that gap. If the CPAP can't work for you and you just can't wear it, the next best thing is a dental device we can make for you in office. We make a device for you, and these devices come in many different flavors, and it pushes tissue out of the way so you breathe better at night. And we treat here mild and moderate cases, and occasionally the severe case if you just cannot wear the CPAP at all. What we'll first do is we'll check to see if you have already had your diagnosis. It's very important before we start making a mandibular advancement device that you've already been diagnosed with sleep apnea. So that'll either be done with your primary care physician or your sleep physician. They'll need to order a sleep test. You'll either take that at home or you'll do an overnight PSG in a lab, and we'll get that result back and that diagnosis. Once we have that diagnosis, we can start the process. We first take photos of everything, then we take measurements with a pharyngometer and a rhinometer, and we get some nice readouts. These readouts tell us how far we need to advance your mandible in order to get clearance so you can breathe at night. A lot of people will notice that their blood pressure decreases and they might be able to get off their medication. Other people notice that they start to lose a lot of weight. Sleep and the sleep cycles are very important at night, and when you're not breathing a certain number of times per hour, that's significant, and we want to treat that patient. I really enjoy my job as a dentist, but most of all, I love working with people. Dentistry involves a lot of tedious activity, but let's be honest, people don't like coming to the dentist. So what I enjoy most is a lighthearted approach, making sure that everyone has fun, the assistant, my patient, and myself, because what we want to do is create a positive experience for that patient. Dentistry is an uphill battle. Everyone knows it. People who come through and they've had bad experiences as a child, they don't like coming to the dentist. We want to make sure that they have that positive experience so they can refer their friends, their family, and we can get dentistry back on track to fun and happy again.
Oh, everybody's a good candidate for a CEREC crown. If you have large restorations that are failing, or you have a crack on a tooth that need to be restored, and a CEREC crown would be a good restoration for you. So a CEREC crown is done in office, and it takes about 2 hours to fabricate. You sit in the office, we prepare the tooth for the crown, we design your crown in office, and it is milled right there while you're waiting. A CEREC crown is a 2-hour appointment where we prepare your tooth 360, and then we shape it so that we can place a crown on it. The crown is designed and it's fabricated in office through a milling machine, and it is placed in the oven and baked to reach its maximum hardness. And at the 2-hour mark, we would be able to cement that crown in for you. So with a traditional crown, we do pretty much the same thing with a tooth, but we would have to take an impression of it. So we use the putty to copy all of the tooth structure, and we have to send that off to the lab. So that impression will be poured up, and then the lab will actually have to manufacture that crown for you. After 2 weeks, it's usually when it's all completed, it's returned to us, and then we cement that in. So it takes about 2 appointments to do a traditional crown, as opposed to a CEREC crown, which would take about 2 hours to do. So you go in the office, you sit down, we do pretty much everything for you. You have a little bit of break for about 30 minutes, and after that, you get a crown and you go home happy. We minimize the amount of trauma that we're doing to the tooth when we're doing a CEREC crown, because they're not wearing a temporary for two weeks. So it's a very easy procedure.
Our opalescence products is what you can take home, which can include a toothpaste, to-go trays, which are no models made or custom trays, or our bleaching kits. For the Quick Pro, that's the in-office treatment, which is a whitening varnish that we apply to the teeth. If the patient experiences any sensitivity, we usually reassure them by saying it's temporary, and usually follow up with the fluoride treatment afterwards to help. Our Quick Pro product can last up to 6 months. Of course, that's with proper home care habits, so avoid smoking and food or drinks that can discolor the teeth. We have options for you. You can use a whitening toothpaste. You can use our to-go trays, which are not custom made or no models are made, so they're just to go, pre-filled, and you just bite and go. And that can be used for 5 to 10 days, or you can do our day and night bleaching kits, which have to be custom made. So it depends on your lifestyle.
A candidate for the Morrison Migraine Center would be any patient with TMJ, TMD, facial pain, chronic headaches, or migraines. During an assessment appointment at Morrison Migraine Center, first we will do a T-scan, which I like to consider electronic articulating paper. Then we move on to range of motion testing, and we map any trigger points that the patient may have. We first start with ultrasound therapy, then we move on to muscle manipulation, which is kind of like a massage. Then we do our microcurrent therapy. We also do our cold laser, and then we end with sometimes an alpha stim. We treat migraines in a general office. Patients that have TMJ, muscle imbalance, clenching, grinding, all of those can be treated within the dental office, and we can also treat those in the migraine center. Treatment is extremely effective, also based on your home care. That is also a component with the migraine center. It gives you your quality of life back. We give you the tools and the knowledge that you need to control it at home after your treatment is completed.
We all have this natural thin layer of bacteria that's on our teeth, and if it's not removed daily, it gets hard and it sticks to our teeth. At this point, then only a dentist or hygienist can remove it. This bacteria will then attack the bone, the gums, and the connective tissue that supports your teeth, causing it to become loose and maybe even losing your tooth. And then periodontal disease not only dampers your smile, but it's also been linked to a lot of systemic diseases, some of them cardiovascular diseases, diabetes, osteoporosis. So when we ask you to fill out your medical history, please do it honestly and accurately so that we as a team can provide you with the best possible result to retain your teeth for as long as possible. Well, when you sit in the chair, the hygienist will say, and you've heard them say, we're going to measure your pockets. We actually have this instrument that has a little ruler on the end, and it fits between your gum and your tooth. Normal pockets are 1 to 3 millimeters. Anything above 3 millimeters, we want to look at it more closely. We will then look at x-rays also to see if we can find any visible signs of bone loss. We will also clinically look for swollen and red gums or gums that even bleed on probing. There's a lot of factors that put us at risk for periodontal disease, but the number one is poor oral hygiene. Then we can go on to tobacco and alcohol use. The more you smoke and drink, the higher your risk of periodontal disease. Certain systemic diseases like diabetes, osteoporosis, cancer, thyroid issues, they will help contribute to your periodontal disease. And then, of course, the medications that the doctors give you to treat these systemic diseases will also influence the periodontal disease. The ones that we take for our blood pressure, for reflux, for our thyroid, antidepressants, all those medications affect your periodontal disease. And then we got good old genetics. Research shows that about 3% of us are predispositioned to some sort of periodontal disease. And then anatomy. If we have crooked teeth or bridge work, those things make it much more difficult for us to floss or use interdental devices to help keep things clean. Well, gum disease is actually a very silent disease, and it can sneak up on you if you don't know what to look for. I'll ask my patients, when you wash your hands and if they start bleeding, don't you get concerned? So why wouldn't you be concerned when you brush your teeth and they start bleeding? We will also look for red and swollen gums, gums that are receding. Us old people have heard the term long in the tooth. That's when you lose your bone and your gum at the same time and your tooth gets longer and longer. If you notice loose or teeth that are shifting position, you need to be concerned. And then, of course, we've got the obvious bad taste or bad breath that just won't go away. Periodontal disease can be treated by a periodontist, a dentist, or a hygienist, depending on the severity. And there are two paths. We have a non-surgical path and a surgical path. The non-surgical path is what you have heard the dentist or hygienist refer to as scaling and root planing. This is a very deep cleaning of the pockets to remove the bacteria that's causing the damage around the support of the tooth. In more advanced cases, sometimes surgery is needed. The most common surgery I do is called flap or osseous surgery, and that's where I will make an incision along the gum, peel the gums open, and I can actually see the teeth sitting in the jawbone, see all the calculus that's hiding in the nooks and crannies, remove that, and reshape the bone. Sometimes bone is lost in a way where I can actually add bone to the defect and regrow it. This is called a bone graft. The bone source comes from either a donor or a synthetic source. And then sometimes we may or may not use a membrane that we'll place over the defect and put the gum back over it. And this membrane inhibits the gum from regrowing and kind of repositioning itself back in there, allowing the bone to take its place and home and try to regrow. And then if you have receding gum, sometimes I can do what's called a gum graft, is where we take tissue from the roof of your mouth and we will transplant it to the area where the gum is receding. And we may be able to replace all or some of the gum. The number one thing in prevention of periodontal disease is to follow our recommendations. Remember, you do not have normal pockets. So this is going to mean that you're going to have to come in more often to get your teeth cleaned, usually on a 3 or 4 month basis. Your insurance probably won't pay for these extra cleanings, but we're not here to treat your insurance. We're here to give you the best advice possible to keep your teeth for as long as possible. So again, the number one thing is for you to be responsible for yourself and listen to our recommendations. And then the simple things you can do at home is brush your teeth for at least 2 minutes. I highly suggest an electric toothbrush. Brush and floss or use any interdental devices that we provide you with. Eat a healthy diet because keeping a healthy immune system is really important. And refrain from smoking.
A dental implant is a surgical device placed in the upper and lower jaw to replace a missing tooth, missing teeth, or to have a denture snap into to make it more solid so it doesn't move around. A candidate for an implant, a patient must have enough bone to have an implant placed. They must be medically healthy. Some contraindications would be patient with diabetes, a smoker, patient on osteoporosis drugs as bisphosphonates. Those types of things we have to look at and make sure an implant will be viable. A patient would get an implant if they were missing a tooth, missing a couple teeth, or wearing a denture. We can replace a missing tooth with an implant. We can replace a multiple amount of teeth with implants. We can actually snap a denture into implants and make them more solid, especially on the lower jaw where a denture will be moving around a lot. And it would increase their chewing capacity and they'd be able to eat their food better. The process for a patient to get an implant can vary depending on the procedure that we need to do. Sometimes we need to take a tooth out before we place the implant. And if that's the case, we may need to bone graft the area to make sure we have enough width of bone and height of bone. And then after a certain amount of healing, we can place the implant. And then after that heals for about 3 or 4 months, we go ahead and restore the implant, whether that be with a crown or a denture that's going to snap into it. A dental implant, first of all, has a very high success rate, 96% success rate, depending on the patient, okay? If they take care of their implant, it can last them a lifetime. If they don't, just like anything, it could fail early. Most problems we see with implants are just a little recession of the gum around it, which is usually a very manageable problem, but it can last a lifetime if taken care of. The cone beam computed tomography allows us to view the arch, the dental bone, in 3 dimensions. So we can see the width, the height of the bone, where vital structures are, including the sinus and the nerve that runs in the lower jaw. It allows us to strategically place the implant to avoid all these structures and to be in bone. A scan is needed when placing an implant, as has become the standard of care in placing implants. We can virtually place the implant on a computer, trace the nerve, look at vital structures, so we avoid these when placing the implant. A CBCT scan makes it more predictable in placing the implant, so we avoid the vital structures such as the nerve and the sinus. A normal x-ray only allows us to see 2 dimensions. A CBCT scan will allow us to see everything in 3 dimensions. So we can twist and turn that any which way we need to see it, to see the height of bone, to see the width of bone, and to see where these vital structures are.
My name is Dr. Robert Morrison. I am the founder and CEO of Morrison Dental Group. I have had the honor to be able to watch this organization grow into what it is today. I was a Navy veteran for 10 years, and right before coming to Williamsburg, where we started Morrison Dental Group, I was at the U.S. Embassy in London. I started Morrison Dental Group in 1992. 1131 Professional Drive, It was just me and a few staff. The reason that I started Morrison Dental Group was probably an accident. It was also in context with what was happening within the healthcare and dental industry, in that we grew because we were blessed. We had enough business and we needed to expand. And then it turned out that other people wanted what we were providing. And that's not just dental service, but it's customer service. And that leads me into the second part of the question, is what are our core values? And our core values are what we live with every day. We hire it, we are on it, we acquire on it, and they were developed by our own staff. Our staff came up with these core values because that's what's important to them, that's what's important to us. And it includes things like always deliver wow service, do the unexpected. Patient first mentality, certainly. But embrace growth and change. It also is respect each other's hard work and achievements. It's also about having open, honest, humble, and respectful relationships, not only with our patients, but with each other. We grew because what we were providing resonated with our patients and our community. And then other communities wanted it. We grew also because of the talented individuals that work here. One of the things we're most proud of is our management team, now that we've grown to 9 offices, is homegrown. They started on the clinic floor. They started behind the front desk. That allows us to keep our core values and our culture intact. We used to think goals for the patient would be show up on time. Now it's participate in your own health care. Not just dental care, but health care. Because what we do is not outside of the body. It's a part of the body, and it needs to be a part of the solution to their own health care. The goals for Morrison Dental Group goes back to our vision statement. We will be the patient's advocate in all things health care. And so our goal is to live up to that every day. Sometimes that means don't treat the patient. Sometimes it's get them other care. Sometimes it's find a better dental home for them at a community clinic if that's appropriate. And it's also being that we need to be that patient's advocate. And we always must stay with one of my long-term statements that my employees probably are tired of hearing, which is we make treatment decisions with a patient, not for a patient. We'll always do the right thing. We're going to do the right thing for the patients. We're going to do the right thing for our staff. We're going to do the right thing for the community. And some of the things that we do within the community embody what my leadership, if you want to call it that, is all about. The doctors that we have a wide range of talents.
So it has one cavity.
We need a wide range of talents. Everybody has strengths and weaknesses. What do I look for when I'm hiring a doctor? I don't ask doctors how fast they can do something or how well they do it. I ask about them. I want to know about them as a person. So when I'm asked, what do I look for in a doctor? It's very simple. It's one word. It's integrity.
So we were on our way back from London, and Dr. Morrison was looking at practices to purchase. And I'll never forget, we were in Philadelphia at the time visiting my family, and he had a notepad with several bullet points of this great dental practice he wanted to look at. And at the bottom, it said, location, Williamsburg, Virginia. At which point I looked at him and I said, really? So we drove down to Williamsburg, and from the minute he turned into the parking lot at 1131 Professional Drive, that was it. He had a look on his face, smile. I knew that was where he was going to buy the practice. So I think that's a great question. What is the synergy? I would say that Dr. Morrison is calm, all of the time, and I am type A plus hyper majority of the time. So it's probably a really good working team. We balance each other out, and for me, it's fun to have somebody to come home and talk to about what went on at the office that particular day, bounce an idea off of him. He'll bounce something off of me. I'll say, forget it. I'm kidding. And, or he'll say, you can't do that. I'm like, really? So I think it works because our personalities are similar, but yet we're a great balance. So Dr. Morrison started Morrison Dental Group when he bought the practice, and I think that the core values evolved over time and really became definitive a number of years ago when we put them on paper. And that's something that we've always espoused, but we really refer to them and live those every day and want our team to do that as well. It's the only way to really provide the type of care that you want to give to your patients, as long as you believe those core values and you are respectful to not only your patients but the rest of the team. At first it grew mainly because of Dr. Morrison's reputation in the community, and it was entirely internal referrals. And he had great stories. We'd come home and say, I got a new patient today. She's 5. Her friend told her she had to come to our practice. And those stories went on for over a decade. And they still continue to this day, but not in that intensity that it was. And I think that we evolved to a point where he couldn't see any more patients in the capacity of one office, so we expanded into a second location, and it was small at the time, and then that grew to our Norge office, which now stands as our corporate headquarters. And then we sort of decided that we were going to expand on the eastern shore of Virginia. There was an opportunity there, and we started a practice from scratch and watched that grow. It's now in its 6th year, and it's done really well. And from there, I think it became a kind of a natural path for us as the Morrison Dental Group reputation for being the patient's advocate continued to grow. Our desire to merge, expand into other geographic areas was there, and it was natural for us to expand. So I think for the patients, the goal that I have is to be able to provide the care that they need, to be able to diagnose and treat them properly, and to educate the patients on that. For Morrison Dental Group, I would say being a regional presence should give patients the comfort of knowing that we have had the ability to grow and consistently provide those same core values, same treatment across the board through all our office locations. Well, I think Morrison Dental Group is unique because you have to have some type of defining characteristic that sets you apart so that you aren't like somebody else down the street. For us, I would say it's our core values, the staff that we have, the providers that we have, and the way we treat our patients. Providing them with those options like we would a family member. I think that's important for people to know that we have integrity and wouldn't do something to them that we wouldn't have done to ourselves. So for me, my role is somewhat different. I'm not on the clinic floor, but I can tell you from the charity events, and when I can go downstairs and see a patient in our waiting room here, or I go to any other office and I can go sit down next to a patient and they tell us how great a job we're doing and how much they like the practice, that's a heck of a lot of satisfaction. For me personally, crossing things off my list, that goes a long way too.
So working at Morrison Dental Group is actually a lot of fun. I really enjoy coming to work every day. I really enjoy the people that I work with and the atmosphere. You know, most of the patients that work with me and the assistants and the hygienists know that, you know, we're all, you know, trying to get the treatment done and having the patient be as comfortable as possible, but at the same time, you know, let's be realistic. A lot of people don't want to come to the dental office. So the idea, at least for me, you know, when they come see me, my goal is to try to make them smile. We have a lot of people within this office that, you know, they are pillars of the community, and that even, you know, my children know them because they work in the same school system. They go to Cub Scouts together. You know, we go to the same church, whatever the case may be. So it's a lot of fun. It's small enough to have that kind of like family practice feel, but then it's big enough that we're being able to help out a lot of people outside of just like the Williamsburg area.
I love all of our dentists here because Dr. Morrison handpicks them all. And if you've met Dr. Morrison, he's hilarious, he's wonderful, he's so kind, he's so caring about people. So he looks for dentists that he believes are going to be offering those same personality traits to their patients. So I know I've enjoyed getting to know all the dentists here. It's fun, you know, if they have a break, they'll come upstairs and they can come to my office and we chat, and it's a really nice, relaxed environment, but it's still, of course, very professional when they're with their patients.
Dr. Morrison recruited me out of Chicago. We actually went to the same dental school. So naturally, I'm going to enjoy working with Dr. Morrison because he's from my school. I like his leadership and his experience because he has a lot of years under his belt. He's seen it all. And so whenever I have a question, I either email him or text him real quick. I get him into the office. And he knows both the business side and the clinical side. So I like to pick his brain, and he's a fun guy to work with. Really, really great with the kids.
Yeah. I love that Dr. Morrison is a great leader, and he's the foundation of this practice. He has been a great mentor for me the past 2 years. He's been there with me in the trenches. Whenever we have difficult cases, he is always available for a consultation, and he helps me out whenever I'm in a pickle.
I've had a really great experience working for Dr. Morrison and Morrison Dental Group. As a new dentist, it's been really exciting being involved in a group practice where I can consult with other dentists, and Dr. Morrison has been very hands-on. He often visits our offices and greets our patients and helps care for our patients. So it's a very collaborative environment, which I've enjoyed. That's my favorite part about dentistry, is working on the patients and seeing patients have healthy teeth and helping to create beautiful smiles. As part of Morrison Dental Group, I've been working on making sure that we're involved in our community. That's something that's really important to me. So I recently came on as Morrison Dental Group's representative for the Chamber of Commerce for Chesterfield County. So that's been a really great experience because I've gotten to participate in activities, meeting other businesses in the area. We all help encourage one another businesses.
I absolutely love Dr. Morrison. To me, he is like another dad. I enjoyed coming to work. He made it enjoyable. We had tons of fun, laughed, but got a ton of work done. The patients loved seeing him. They didn't even know they were getting treatment done because he was telling jokes the whole time and made them feel like they were at home and part of his family. Well, first off, I love our patients in general. Dr. Mahardy has like a following, if you will. But I love the before and afters. You know, they come in, they think they're at rock bottom and nothing can be fixed. And all of a sudden, 2 weeks later, they're back to looking fabulous, and they don't ever think that they could have done that. And it's so rewarding when, in the end, they give you a hug and they thank you, and they're crying. First off, Dr. Morrison lives by the core values, which we came up with those core values like 6 years ago, I think, which is awesome because all of us strive to follow those the way that he does, and he leads by those, and he's a great example.
Bob approached me at that time when I was looking for a new position, and Bob's a great guy, great dentist. Got to look at the practice. It's a practice that we do comprehensive dentistry, not just fixing a tooth. We're looking at the whole mouth, the whole body. So working with Bob has been a great opportunity. Also, the office is loaded with technology. We have so much technology in that office, including a CBCT machine, a CEREC machine, all these things that you can't get in other places. It's really an advantage to our patients. At Morrison Dental Group, I am so fortunate to be working with people that love doing dentistry, love supporting the dentistry that we do. My colleagues are outstanding in their field. We have a periodontist on staff, Dr. Mary Kiter, who's excellent. We have guys that specialize in doing certain things as far as root canals. My assistants, I couldn't do my job without them. I have 2 assistants, and they do more work than I do. They just help my job tremendously. And the colleagues that I work with are just great people.